Good. Okay. Right. So the first session, it gives me great pleasure to welcome some colleagues here to actually talk and kick us off this morning. So, social care and health. Can we really work together? Integration comes to mind there, and I have to say we've been integrating for the last 40 years of my career, so we still haven't quite cracked it yet. I wonder how many years it will take. Anyway, there's a fantastic piece of work going on, and these guys are going to tell you all about what they've been doing to move the project forward. So I'm going to hand you over to Mel and Faye, Amy and Rachel.
There's a story about this. You can tell the story. Right. Good morning, everyone. I'm going to start our presentation with an apology to Rachel. My skills are generally within occupational therapy and not within presentation editing. Hence, I did write your name. I promise I wrote your name. So, this is the story of our integrated therapies project. Which involved all of the therapy leads across the west of Kent. The aims were to improve patient experience, reduce duplication of multiple therapists. I'm sure everyone around here can tell you the stories of when you've just gone out to assess someone only to be told someone had left half an hour before you. And actually for the person that's a pretty rubbish experience, but also for us therapists where we've got such a huge demand on our services. Many people have to wait a long time for our service. It's not what we want to do. We want to improve joint working and collaboration. It's about promoting our communication, talking more to each other and understanding much more what we all do in our different specialisms. And get the person the optimum pathway of care as soon as possible. Okay. So, within this, we had 5 streams of work, which each reported to a central project group. We had the mental health stream, and initially this came from COVID, where we'd recognised in the early days that people were experiencing very poor mental health. Through the isolation and not having contact with services. So the initial idea was about looking at the possibility of screening tools so that all therapists could look at doing some screening on their interventions to identify whether people were experiencing issues with their mental health that might need further follow-up. That has further developed, which Amy is going to talk about today. The next stream is about single assessment, moving and handling. Initially our objective, again, was different. It was to look at a single, comprehensive therapy assessment that suited all occupational therapists in all situations. Do you think we could agree? No. So we think that task is a little bit large at the moment. So what we did think was let's pick one area that had a common theme to most of us and start from there. And hopefully that's something we can build on. Single point of access. So at the moment our services all have different front doors. And for a person trying to access the services, they get signposted in different places, not knowing where they're going to go at a time of crisis. So actually the discussion is, can we do something about having one place so people can get where they need to go as quickly as possible? And we also had demand and capacity. So we wanted to look at the therapy resources across all areas and the demand on our services, which is really difficult because occupational therapy don't tend to kind of measure that. We know we've got a lot of demand, but not how it's used. And thinking about this for workforce planning and how we best use our therapists at different times across different areas. And we need to think about this as our workforce because, as Jane was talking about, we have a national shortage of occupational therapists and locally we're all struggling. So we need to we're a very, very important resource. We need to make the best use of us wherever we can. And the final part of the work stream was about trusting assessment. So this was about looking at our skill set of therapists, building our relationships, understanding what we do, not repeating assessments, so we trust what our colleagues say, and getting a speedier response for the person. So within our presentation, we aim to cover 3 areas which have kind of progressed to completion or near enough completion, and that is trusting assessment, mental health, and the moving and handling risk assessment and plan. Okay. I'm going to hand you over to Rachel. You want me to press? Just go next slide, please.
Okay, right. I tend to wave my hands around quite a lot, so if you lose me because I've moved the mic, I do apologise. So the first thing we're talking about is our therapy role awareness and networking. So where did we start? We started with a working group where every good project starts, and we had a group of therapy leads and senior OTs from a multitude of West Kent organisations. So we had representation from the acute, from mental health, from social services, and from the community health sectors. So we had lots of discussions about where we start, because we were given the remit of, can you just look at trusted assessment concept and the training that will facilitate this becoming a reality, that nice small target for us. So we had some discussions about what we felt as these were the issues, and what we felt is that we got quite nice engagement at that senior level, but what we fully appreciated was going to be our challenge was the fact that we're multi-organisational and we have hundreds of therapists and support workers working underneath us, and if we're going to make anything work successfully, then we need to have something that's going to result in engagement and something that we can build on at that ground level.
Next slide, please.
So where did we start? We started by looking at a survey that we sent out to our staff. It looked at 3 main things. One was looking at where do we feel we are now with our communication and our information sharing between all our different organisations, and how joined up is our care. And we got the answer we expected, which is really not very. We also then got the consensus that actually what our therapists also agree on is the fact that joined up care would be a good thing for our patients, and it would be a good thing for us. From a therapy perspective, it would mean there was less duplication, more time released, and from a patient perspective, you're looking at improved experience and journey. So that was the consensus too, which was good. But the issues we've then come across is the fact that there's clearly barriers, and the barriers that our staff felt existed were about competency of the staff in the different sectors and knowing what that was, trust between our colleagues, and also process across multi-organisations. Next slide, please. So we were like, right, okay, we've got to address the barriers. That's where we've got to start from this networking and this engagement perspective. So we've got a lack of trust and confidence in the assessment of our colleagues. Why is that there? That's ultimately because we come from so many different organisations where our processes are completely different. We all write in different systems that we can't read, so we can't see what our colleagues have written down about the patients. We're not that good at giving that much information when we hand our patients over between us. And also we don't necessarily know, or did we know, what was out there and what was available to us, and how many different types of therapies were there in West Kent that we could be utilising better. So our plan that we got from this was like, right, we need to do some big networking event where we are looking at educating our staff, telling them about all the therapy options that we've got in West Kent and what they do and how we can use them better, and to provide a networking opportunity to increase familiarity between people, because you're always more likely to go and ask a question of someone that you've met before, or a service that you understand a bit better. So what we did, we ran some workshops. We used a virtual forum, so we did it through Microsoft Teams, partly because of the time when we did it, and the fact that trying to get as many people together as we wanted to, and COVID is a limiting factor. But we were also aware that we were coming from a really broad geographical area, and trying to pull in people from acute settings, community settings, and actually access to this forum virtually was probably going to be better. We delivered 3. They were all the same, it was just to offer a multitude of dates and times. And we've got about 90 therapists in all go through the networks for us, which was, we thought, really good attendance for our first trial. The content, so we had delegates there from acute settings, health settings, specialist services, KCC, mental health, we're not there at the time, were they? I'll come back to that one, and some of our specialist services. And so each represented service did a presentation about themselves, a short, sharp snapshot of who they were, how many of them there are in their team, what their function is, how you refer into them, what they do take from a criteria perspective, what they can't cover from a criteria and skill set perspective, and how to contact them. And then what we did, once people had had the opportunity to listen to that and to kind of digest all that information that was thrown at them about who exists in West Kent, we split them up into mixed groups of people into breakout rooms. And we looked at 3 different kind of discussion options. So initially we just let them network, we let them introduce themselves, say who they were and where they came from, so you've got some faces to names. And then we looked at 3 facilitated questions. So we're looking at duplication. What is duplicated between all these services that you've just heard about, and why does that happen? So really basically trying to use, we were in a nice position where we had all these ground level clinicians in one place, so why were we not going to pick their brains to find out more about what they wanted and how we worked currently and what problems they were facing there? So that's what we were doing. We looked at duplication, we looked at optimising communication, how can we actually communicate with each other better across services? And also, how can we maintain a greater unity? If we've come together now, how do we keep this going into the future across all our organisations? Output-wise, I mean, how did it go? It went really well, actually. We had 90 people turn up. I think that's a win in itself, isn't it? We gave that network opportunity. We now know much more about the services that are out there in West Kent. So our education box has been ticked to a certain degree for what exists and how do we use it. We've got a digital resource, so because we use Microsoft Teams, we were able to record it, and after a little bit of technological challenge, we now have a video that we're able to share, so we can use it for induction of new starters, so there's something we've used, can continue to be used and shared. We also have like a paper or PDF version of all the presentations as a resource, and we've got a nice contact list as well for all those services, which we've been able to share out across everywhere. And also, we got some really valuable things coming out of the discussion forums, and I think that's been really powerful in helping us to set up what we're doing and where we're going in the future with some of our other work streams. Lots of the things that came out fed into plans that we already had, like about our referrals, and ultimately wanted to move towards a single point of access in the long-term future, and things about communication and how we do that. One of the things that we looked at was how do we keep this going? How do we not just have done one event where people have met each other today and they've had the opportunity to talk, but how do we keep this networking continuing across all these West Kent therapy forums? So that was one of the things that's come out as an objective for us, and we've talked about the potential of having kind of annual or 6-monthly networking events where there's some kind of education element and also the opportunity to network again. And it would be lovely at some point in the future to not have to go virtual for us, people in the same room. And the other thing that we flagged up was the fact that we hadn't captured everybody. Inevitably, you try really hard, but there's going to be odd people that think, oh, we should have invited them and they could have come, and what about these people? And we'd like to know more about. So we've also got that as agenda for future meetings and future networking opportunities, and to invite in and to include. But yeah, ultimately, where we've got to is the fact we talked to each other. We put people in the same room and we talked to each other and we communicated. Have we solved the world with one thing? No, but have we got a really good start point? Yeah, we have. And one of the teams that came up about being involved more in the future in the networking was the mental health. So I'm going over to you.
So I am a rogue mental health OT today, and I've been the only mental health OT I think in the group, haven't I? So I've been trying to bring my expertise into some project streams. The one I've been leading on has been working in partnership between mental health and physical health. So I work for Condon Medway Partnership Trust, which is a mental health trust that you might be aware of across the whole of Condon Medway. We serve a population of 18 and above. We have a range of different services, ranging from mother and baby unit to acute inpatient wards, community mental health teams, dementia care teams, list goes on, it's quite large. So I was asked to get involved in this project with the kind of the first remit that Mel talked about at the beginning, which is kind of morphed into something else really. But obviously taking into consideration what the needs are across the area, across the patch. So it's myself, I'm currently in an allied health professions workforce lead role, and Ben Smith, who is our Director of Psychological Therapies within KMPT as well, so we've both been jointly leading on that. What we decided to do was start up a mental health task and finish group. The idea being that the objectives were to understand in scope, community, physical health staff's challenges in terms of supporting their patients with their mental health issues. So again, quite a big thing in terms of trying to kind of manage that and understand how we could kind of solve that. Again, we're not quite there, but we're working towards it. The key areas of focus were system working, so what I've got off on the slide there. So working in partnership, basically, across the system, across the West End patch, although we've recognised within the mental health work stream, actually it kind of spans the whole of Kent Medway, considering KMPT, that's who we kind of serve across. Delivering holistic care, seeing the patient as a whole person, ultimately, so you might be a physical health therapist, you might be a mental health therapist, we shouldn't just be seeing that area as somebody, either way, we should be looking at the person as a whole and working holistically. So how do we do that? How do we ensure that we're meeting all of those needs? Increasing, developing and sharing skills. So what we kind of highlighted was that there were gaps in knowledge around mental health, as there would be gaps in knowledge from a mental health perspective in terms of physical health. Obviously, as OTs, we're kind of dual trained. You know, if you're a nurse, you go into mental health, you go into physical health. We have the luxury, I suppose, of kind of knowing all about it, but then once you specialise, you kind of tend to lose some of those skills, and I know within mental health that kind of goes quite quickly if you're not using them all the time. So vice versa really, but we all are coming up against a different range of patients every day with physical health and mental health needs. And ultimately, one of the main kind of objectives really was for improving patient care and experience, which the whole of the project, all the different work streams were covering. So we had reps from West Kent providers, as others have said. What we did first is kind of do a bit of a gap analysis, so we highlighted gaps in knowledge of mental health and understanding services. So it was quite clear really that there were a few gaps, so people had some really good basic knowledge, but we understood that they needed more really. They needed, I think it was more around confidence, probably confidence in terms of what do I do if I come up against this issue? What do I do if someone's saying that they want to self-harm? What do I do if the risks increase? Do I leave the person? Do I go and seek support? So we started to talk through the different areas and different levels and stages that might present that therapist with. So in terms of that, we had lots of conversations, we took in lots of different viewpoints, and we developed some guidance or operating procedures that we were going to use and share. As with everything within the NHS, everything changes day by day, and within the community mental health kind of remit, so we're coming up against a big change at the moment in terms of our community mental health transformation work. So within KMPT, we've decided to pause that in terms of sharing that document at the moment, just because everything will look extremely different going forward. It doesn't mean that we've lost that work. What we're going to do is move forward, and we've actually got our first workshop tomorrow. So we've got, I think, quite a few actually people coming. I think 40 plus, possibly more, people to a workshop tomorrow that myself and Ben Smith will be running. We've also got some lived experience reps within that who will talk us through and come answer questions from their perspective. So really understanding and explaining to people actually what it feels to be on the receiving end, and maybe not necessarily being asked the question the right way, whatever that might look like, and kind of being a bit more inclusive in terms of how we work with people. What we'll be doing tomorrow is we're going to be looking at some scenarios. So what we did is we kind of gathered some scenarios from different areas. So people next to me all contributed in terms of providing common scenarios, I'd say, in terms of you go to someone's house, they might not let you in. How do we kind of motivate engagement with it? They might be hoarding, or actually I've gone to them and they're saying that I feel really unwell mentally, or I might want to self-harm, etc. What do you do in those situations? Now it's really important, and we've said it all the way through, Ben and I, that we don't have all the answers. Everyone's so different, and you'll know that as therapists, that you when you see somebody, you have to go on what you've got there in front of you at that point in time, and everyone's needs will be slightly different. So we don't have a magic solution. What we are going to do though is talk through different case scenarios and think about different ways of managing those different risks and different needs across. So what we are hoping to do in terms of kind of that sustainable piece that Rachel was talking about and moving it forward, so we don't lose all this really valuable work, is hopefully do some more of the sessions, which hopefully we can spread across Kent and Medway, rather than just in the West area. Looking at kind of being collaborative, and now we've got some really good links with each other in terms of kind of linking with physical health services as well. So kind of learning from each other's skills, etc., and sharing resources, but also wanting to kind of work with the CCG and the ICS around some videos. So not videos for patients, because if you Google mental health stuff, you always get a load of information around what can you do for a patient when you have a mental health need. What we actually highlighted was that staff don't quite know, and they need some support and guidance and some training material. So what we'd like to do is develop a video across the whole of the system. And ultimately, hopefully just increase people's confidence really with kind of working with people with those dual needs.
So we've been doing quite a lot, haven't we? So, the next stream was about integrated moving and handling, risk assessment and handling plan. So, as I said earlier, our ambition was about having one comprehensive assessment, but we needed to start small, and OTs never agree on anything. So, we recognised moving and handling was a key area for therapists where the person often changes their function and their care and support needs following a change in their healthcare, and they change very quickly in their moving and handling needs. So from admission to discharge, community, readmission, planned changes in their health deterioration as well. So we recognised that all services were using different forms for different purposes. So although they had moving and handling assessments, and that's what they were titled, they'd also morphed into functional assessments, home visit, access reports, etc. So actually, we said, okay, what's the purpose of what we're doing? And that is our documentation is going to be the purpose, which is our required risk assessment and handling plan. The forms that we had were of various quality and very difficult for providers, not alone our people we support and their informal carers to follow. We had different therapy approaches and different levels of recommendation, so a bit different across the areas. There was duplication throughout the patient journey, because as I've said, you might have someone in the acute for 4 days, then they might go on to TADS in West Kent, where they've had a change, they've got to write a completely new plan. They go on to, with Hilton, they come on to Kent County Council, go on to enablement. We come along, got to write another plan. And then through short-term pathways OTs, going into the community OT, got to write another plan. So actually, that is a lot of work for everybody to do for, little gain. We don't often need to rewrite absolutely everything, it's about reviewing and amending it. But the formats we use don't allow for that. The other issue was finding these plans when we need them. We spend an awful lot of time writing these moving and handling plans, don't we? And an awful lot of time documenting them. They're not being used if they can't be found. So definitely, I know in social care, you get your Friday afternoons when an agency's changed. You're trying to get somebody onto enablement, you can't find the moving and handling plan. But that actually means that we can't get somebody on a service, which causes huge risk to everybody. So for safe care, I don't think therapists realise how important your moving and handling risk assessments and plans are. I think you need to give yourself credit for what an important document it is to safe patient care and delivering a person's care and support plan under the Care Act. It's really, really important because it tells you how safe care should be delivered to the best for that person. So Without that, the person and the care agency, etc., is at risk. So that's why there has to be a plan, and that's why you often hear us going on that, well, we're not going to accept a person without a plan, because it is so important. Okay, so we then set up some working groups, started small. As I say, this was started as a West Kent small thing. So we took some forms from across different strands of occupational therapy, and then we kind of thought, oh, we need to go a bit bigger. So we gathered some more forms and involved some more leads. And we also include, I've written down to say, Medway Council into this, because they often get left out of things because separate unitary authority. But actually, they're part of Kent, we all cross borders, so it's really important to work together. And this was about using an agreed format, so we kind of took the best from what we could. We've all had to give a bit. I think the thing is, therapists, we all like our own documentation, our paperwork, we all like our own routines. And actually we all had to kind of compromise a little bit, and I think when the forms come out, you'll probably also feel that, because they're a bit different and there is compromise for us all to kind of work together. So, although it was a West Kent project, we needed to focus wider, because a lot of our organisations span further, as I said, and we work across a lot of geographical borders as well. This was going to be quite a large and complex change, so we needed to try and get it right the first time without kind of doing something in the West and then North Kent go, I don't agree with you, and then East Kent go, I'm not agreeing with you. And so that would then kind of create a whole problem and never get used. So we thought, let's think about the future now. So we decided we knew that there was KMCR. We thought we're going to record it and we're going to store it there. It's one central place. What is KMCR? So this is Kent and Medway Care Record. So some of you probably in the hospital trust will know exactly what I'm talking about. Our kind of KCC possibly less at the moment because we haven't got access to it. So basically this is a central point where all of our organisational systems will put information in. So we will have much more comprehensive sharing of patient information and their social care information to help us make better decisions more quickly for people. Okay. So the challenge of this was that different organisations have different organisational access. Some of us will only have read-only because the purpose was it was going to be an information tool. But being occupational therapists that we are, we decided we didn't want just to be reading it. We want to edit it, we want to write into it because we realise the potential. So we want to kind of take it to the next level. So we've had to kind of work around some of the, and we are still working around some of the governance issues there, because a lot of our health colleagues will be able to input into KMCR, but some of us it was going to be read-only. So that's something that we're all working on at the moment. We're then at the moment in the testing phase. So after we sorted out which kind of form we thought was going to give us what we wanted, we spoke with GraphNet, who have made KMCR. They developed the e-form. And actually, we're in the middle of testing at the moment. So we've got reps who are going through the form, typing it in, trying to break it to see what's how it works and how it works functionally. We've had to extend testing because there have been some issues, and I wouldn't say it's 100% perfect, but actually it has so much potential for giving us the information that we need, and it is so brilliant to go into a form and then go, okay, these guys have just written it a little while ago, just had to update it. It was so easy. So from that point of view, that all works. So that was, that's been really, really good. We can definitely see the potential. Okay, we've got workshops will be planned once we get the formal sorted on GraphNet. Over the summer we'll do some workshops to introduce all of you, all organisations across Kent, on how it's going to work and also a good practice guidance. And we'll do it online because getting us all together isn't going to be very easy, and we'll do some different ones at different times of the day. So I think what you need to do is kind of talk to your organisational lead therapist and look out for dates that will be sent to you. We had Bournemouth moving and handling sheets, so I'm hoping lots of you know what I'm talking about. So these are good practice moving and handling sheets that have basically picture-based, really easy instructions, which gives us a consistent approach. So West Kent CCG funded licences for some key organisations across the county that didn't have it. Some of us have used it for a long time. This means that we've got a consistent approach. It's easy for clients, carers and providers to follow. It's very much based on reduced carer handling, and also it means that our handling plans don't need to be so wordy. You'll be able to kind of just cross-reference, so it saves time, and it's actually just going to be the pertinent information you're going to write down. Single-handed training sessions have been held for NHS therapists across West as well, which have been really, really positive. We've used the same trainer that Kent and Medway social care use, and that's been really positive. The idea again is that we make the best use of resources that we have, that all therapists understand community equipment, that we're working in an enabling and independence approach for what the person needs, which for the agency will increase their capacity. We know there aren't enough care agencies at the moment. There's a huge national crisis. We need to get that right now, and it will increase the ability for agencies to do that, as well as actually saving money to the organisations as well, because it should be about the right level of patient care when they need it. Okay, so that's the work on the work stream. So what's been achieved?
So, a lot of great work, obviously. We've talked about quite a few projects, and that's only a kind of drop in the ocean. A lot of great work to improve the patient's journey across the system, so improving communication between providers and clinicians, positive feedback for the work completed so far, which is highlighting the need, which is really good, so actually we know that that was needed and we knew we needed to do it. Recognition and understanding of each other, different services and the challenges and the impact we're all trying to make. So that was really important, actually understanding where we're all at. Sometimes we get frustrated with each other in different services, but actually understanding we're all really in it for the same purpose, which is the patient. Ultimately, integrating therapy across West Kent and beyond. So we want to push this further than just West Kent, as we've said with a couple of projects. So much more can be achieved and barriers are broken down and system-wide support is focused on. And in terms of barriers, that's kind of looking at organisational barriers, roles and professional groups. So yeah, lots.
So as you see, I've got the short straw because everyone said everything already. But so just to sort of recap really, the mental health, physical health therapy sessions on tomorrow, which is really, really looking forward to. And moving and handling joint documentation launches will be at some point this summer once we've tweaked the form and the system a little bit more. And then it's about really implementing all of the work that we've done and making sure that we continue the communication. I think it's been really good for us with doing the workshops to extend our communication between all of our different services, but we need to make sure that we're supporting all of you to be doing the same as well, and to really embed those into it. What we want to do is we're going to evaluate all of this work, so watch out for your registration. We'll be getting some kind of questionnaire come through to you all, because we want to know how has it impacted on all of you, and how has it impacted on the people that you work with, because obviously that's ultimately, you know, why we're doing what we're doing. So and you know, we need to get that information so we can work on the next part of the puzzle as well. And obviously we're going to do the implementation of the movement and handling documentation, so that was the second part to it as well. So Technology has been our friend and foe all the way along, particularly for me, as some of you may know. But obviously with the introduction of KMCR, that was an opportunity that we needed to jump on really, because we saw it as an opportunity in a forum where we could share information and start to reduce that duplication across. And as my colleagues say, that's grown bigger than we ever thought really, as most of these things have done along the way. Really our sort of main takeaway from this and what we want to continue and continue with our next steps is communication between us, between all of you, and just making sure that patient journey is the best possible experience for them. As Mel says, it's a time of crisis when people come to us, so we need to be making sure that we're working in the best possible way for them to reduce the handoff, the duplication, and therefore the best value for them and for you. Thank you for listening.